Yeah, welcome back to DXB today. It's a bit of a healthcare special for you today. It goes without saying, people have a few concerns out there, might be to do with their medications or a forthcoming procedure, but the message is loud and proud that healthcare continues apace. It is business as normal. Now, let's move on, because the use of telehealth is on the rise. That's what we've been discussing already. But does this ease the pressure on doctors and hospitals alike? Let's ask our next guest. Ayman Shreiha is the co-founder and the chief operating officer at Al Tibbi Digital Healthcare, and he joins us live here on the sofa and on the show. Thanks so much indeed for being with us.
Thank you for having me.
It's a fascinating time for so many at the moment, and more so than the space of telehealth, where we're seeing the evolution so quickly. And again, the ability for telehealth to step up in times, challenging times like we're experiencing at the moment. Let's get into Al Tibbi if we can. For those that are using Al Tibbi, they will know it all too well. For those that aren't, what are they missing?
Well, Al Tibbi is, at the moment, is your digital front door. So it's an integrated virtual primary care program. It combines content and patient education with virtual primary care, with chronic disease management and everything that covers it after. So what we are aiming to be is becoming an end-to-end healthcare platform that the patient can start and end their journey on the same, in the same place.
Yeah. Right?
Yeah, very good. I'm just curious, with the current situation, what kind of changes you're seeing in utilization? How are the patients using the Al Tibbi platform? What's changing?
To be frank, not a lot is changing, which is a great sign, right? At times like this, patient behavior hasn't dramatically changed. We're seeing a bit of uptake in utilization from patients coming in from insurance companies. That's always healthier, because telehealth is the more you use it, the more efficient. It's a signal for a healthy and efficient healthcare system. It redistributes doctor visits in a much more efficient way.
So what are you seeing on the ground at the moment? Are you seeing more people turn to telehealth? Is that what you're kind of seeing generally?
Yeah, again, the adoption is gradually increasing as a trend in general. There is a bit more increase in adoption. At times like this, there's a lot of uncertainty. We do see a tick up in more mental health consultations, mental health driven consultations, a lot more anxiety, and in areas where people are uncertain on what's happening, but nothing nothing major is changing, as I said.
Ayman, let's talk about one of the pain points in healthcare, which I think you guys so well address, and that's waiting, right? Whether it's waiting in traffic just to get to the hospital, or actually in the waiting room. So how quickly is the patient going to get the care that they need with Al Tibbi?
In general, it's under 1 minute. So it's been 10 years of experience in technology and operations, where we have physicians around the clock, multiple physicians in an hour, and we've restructured our payment solutions and the incentive scheme for our doctors to actually offer fixed and variable pay. And the variable pay actually comes in similar to surge pricing. When you have peak demands, we increase the variable pay to incentivize the physician who are working part-time or from their homes to actually do a lot more consultations. So we obsessively look at waiting time, because it's a big indicator of patient satisfaction, and we try to keep it below 2 minutes.
Yes.
How essential to the sort of healthcare infrastructure are platforms like Al Tibbi and telehealth in general at the moment? I mean, it used to be, and again, don't take this the wrong way, but it used to be a nice to have, didn't it? A tick the box.
Yeah.
And people were like, oh, if I can't make it down to the hospital, then I'll get online. But now it seems like you've got patients who just wouldn't do anything other than online.
It's an expectation now. If you're an insurance company and you don't offer telehealth services, I don't think employers are going to subscribe to it and buy insurance from you. If you're not offering even free, at least primary care telehealth, you're falling behind. So we're seeing a lot of insurance companies now eager to talk to us. They want to offer an integrated, virtual health solution. At 5-10 years ago, we were knocking on their doors, begging, pleading, and the sales cycles were 2 years, 3 years. Now you're seeing sales cycle go down to 3 to 6 months, which is a sign of maturity and adoption.
sure it is, yeah.
Perfect. I mean, I'm just curious how you describe it from your position, but I mean, I'm a user of telehealth regularly. But for someone who maybe hasn't utilized the service before, what should they expect? What are the benefits? How is that handoff between telehealth and traditional face-to-face healthcare?
Look, we're even, I'd expanded more, not say telehealth, I would say just digital health in general. It's basically an integrated approach. It's a way for you to continue your healthcare journey in a seamless manner. So your information is interoperable. And it's evolving with time. You're getting a lot more signals from technology, so the doctor is able to give you a much better assessment of where you are, and that's the biggest reason why.
So I'm interested to know, how does a platform like Altibi reduce pressure on hospitals?
Yeah, good question. There's a lot of studies that say that 70 to 80% of doctor visits can be resolved online, and it's just a matter of how many signals you can send the doctor, or you're able to send the doctor through technology. Back in the day, the doctor would hammer your knee, or like at least use the stethoscope to get certain signals. And so if you can get them through technology, then there's no need for you to go to the emergency room. And a lot of the cases, I would say, for the ER, if you can just wait 24 hours and see if the symptoms subside, there's no need to go to the emergency room. I mean, not all of them, but a lot of them, if you can get a doctor on a call within minutes, and they would give you the reassurance that you need. I'll give you an example that happened to me personally yesterday. My son, his 2-year-old, he was running and then he fell. He started complaining about his knee. My wife wanted to go to the ER. And I was like, let's just wait and see. Half an hour, he's still in pain. Okay, let's get a second opinion. Let's call someone and see what we need to do. And so we got a doctor online, and the doctor basically said, give him some Brufen or paracetamol. If he's still able to walk, and in 24 hours, if he's still not if he's not complaining about the pain, then you're good. Because if you take him now to the ER, they're gonna give him an air cast, and it might be unnecessary. So I just wanna. I thought I'd wait and tell my wife on live TV. I told you so.
Well done. Now, Altibi is available across the region, right? So let's talk about your services in Arabic, because we want to know how important it is to be available in Arabic, because it's not just about the language, it's cultural relevance as well, right? Could you tell us a little bit more about that?
So cultural distance is very important, especially when it comes to topics like mental health, sexual health. These are very relevant, and so to be culturally aware is very important, and it directly affects patient satisfaction and what they get out of the consultation. Aside from that, there's the localization factor of certain diseases. You have something like the familiar Mediterranean disease, which is not prevalent in other places, that the doctor needs to be aware of, or certain symptoms can be triggered by, for example, the dust in the air versus something else. So the local factor and environment is actually quite critical.
It's time to go there. 2 letters, you know where I'm going. We can't have a conversation with mentioning A and their friend I, can we? So AI seems to be impacting all of our lives at the moment, or we're just becoming more aware of it at present. Talk to me about integration with AI. I mean, obviously you're using AI already as part of the platform, but are you relying on it more? Is there more ways that you can integrate it further?
Yeah. So we started using or investing in AI in 2019 or 2020, and we created our own small language model in Arabic, because we are mostly Arabic first. And I think in terms of patient-facing AI, I think it's solving one of the biggest problems in healthcare, which is patient engagement. Patient engagement leads to patient education leads to conviction, and conviction leads to adherence, and which leads to better outcomes in healthcare. So if used properly, obviously it can improve the cost of care and the quality of care. And one of the great things about AI is that if you're making 1,000 dirhams per month or 100,000 dirhams per month, eventually, hopefully, everyone would have the same access to the same quality care, which is honestly a great thing.
So let's talk about credibility. I think people are sometimes a little bit dubious about using a remote system. How do you reassure your clients that they're getting just as good a healthcare digitally as what they would going to see a doctor in person?
Yeah, so a lot of, I'll talk about the patient perception of quality of care, which is also different sometimes or more comprehensive than the actual quality of care that, for example, the doctor might give. But in terms of at least waiting times, the doctor actually listening to the patient, taking the right history, offering patient education, taking their time during the consultation, has a direct impact on the quality of care. We at Al Tibbi, take this very seriously. As soon as we started our telehealth program, we started 2 tracks, which is a healthcare quality assurance committee that basically samples the consultations over 5 different criteria: patient education, history taking, clinical judgment, website manner, even empathy. And we offer direct feedback to the doctors based on this sample, and we build medical education for the physicians to actually improve the quality of care. So I always say, get me a doctor with 2 years experience. By the time they're working with Al Tibbi for a couple of years, they've elevated themselves to like 10 years of experience because of the direct feedback and the continuous medical education. So that's one part, and then on another part we do incident reporting. So we track everything that is happening, patient reported or doctor reported or technology, and then we also have a committee that does that, analyze where the incidences are and how to improve or at least increase the turnaround time or decrease the turnaround time to actually solve these incidences immediately.
Just very quickly, just to wrap up, takeaway for our viewers out there. Obviously, during times such as this, there are a few questions out there. There's a bit of anxiety as well. For those that start asking the questions about access to healthcare moving forward, what is your sort of message to everyone?
I mean, you're not alone, right? Part of the salvation of this is that we're all in this together. And, if you're feeling anxious or scared or, things might be unpredictable at the moment, obviously things will get better. But you need to know that you have access to to all the tools in the world today and the right technologies to enable to basically ask and get the help you needed within minutes, hopefully, with technology. So definitely take the first step and we'll be here.